Welcome to the H&HN Daily Most Wired Innovator Award Series. I'm Suzanna Hoppszallern, Senior Editor at Hospitals and Health Networks magazine. Electronic house calls, or e-visits, are being offered by UPMC primary care physicians to their patients for more than 20 conditions. UPMC received a Most Wired Innovator Award for this convenient, cost-effective alternative to in-person visits and phone calls. Today, I'm joined by Suzanne Paone, Executive IT Director at UPMC, to talk about the e-visits. Welcome, Suzanne. Thanks for joining me today.
Thank you, Susanna. It's a pleasure to be here. The electronic visit, or the e-visit, is a technology tool that we rolled out at UPMC about 2 years ago, and it functions as part of the overall secured patient portal, which is very similar. I remind people to think about online banking, where a consumer or a patient, we use that term interchangeably, can get an account and join an online portal. So as part of that experience, we decided to roll out ambulatory electronic visits. We developed the tool in partnership with our supplier, our electronic health record supplier, and had a great deal of input from the physicians at UPMC. The content was all built out by physicians, and the content is questionnaire-based. So as a patient with a UPMC physician, you can log on to this tool and find a questionnaire that matches what you think might be your issue. For example, I think I have a headache, I have back pain, I have sinusitis. So the patient chooses what they think they have, and then they go through a series of questions.
Now, how did you get physicians on board with a new service model like this?
Well, we have a very, very dynamic and strong physician leader. So, our philosophy at UPMC with technology is that the technology group is really, and I like to say, the back seat. We don't sit in the driver's seat of the bus. We're an enabler. We're a facilitator. So our physician leader's practice was the first practice to go live on e-visits. And that individual did it himself and led the physicians in his practice through the change process. They experimented with workflows, coverage models, and I think his passion for wanting to use information technology in a very strategic way was almost infectious, no pun intended, within that practice. So when physicians saw that it worked, and that patients liked it, and that patients wanted it, then it caught on. And then we rolled it out to over 200 practices a year and a half later. So we really took that pilot approach, working with a couple of physicians who were willing to be pioneers.
Are patients willing to pay for this service, and is there other reimbursement for the service?
They are. In our market is a very competitive market. We have a health plan that covers about slightly less than 20% of the covered lives in our region. Our health plan was a leader in paying for this service up front and partnered with us in that regard. We have a couple of other insurers in the region that are starting to pay for it. And we have had communications with both CMS at a federal level and medical assistants in Pennsylvania to start to work with our partners in the government to help them understand how this tool can help meet some of their objectives. And yes, to answer your question, Susanna, consumers will pay $30 in our case, as we did the costing model for an e-visit gladly. So we've learned that it's a service that people want, it's a convenience, our physicians are also very diligent about the service model. A typical e-visit is answered in about an hour and a half. So that's very valuable to people.
Thanks for joining us today. Look for more coverage on the Innovator Award winners in the upcoming issue of Hospitals and Health Networks magazine. I'm Suzanna Hoppszallern for H&HN Daily.